I'm Jasmine Gill. I'm the Outreach and Advocacy Coordinator here at BDFNC, Bleeding Disorders Foundation, North Carolina. And today we're just here to tell you a little bit about what our foundation is and what services we offer, and essentially how we can better connect to the Latino community. Awesome. So I did want to go ahead and discuss our mission first. So we're a nonprofit and we're dedicated to improving the quality of life for people affected by bleeding disorders. And this is through advocacy, education, promotion of research, and also through a variety of programs and services. And sorry, and then our vision is for everyone who is affected by bleeding disorders to essentially achieve their full potential without any barriers or limitations. And then I'll pass this over to Dr. Abajas, who should be explaining a little bit more about what a bleeding disorder is, and then also the common types that we see in our community.
And so thank you, Jasmine. So we see all sorts of inherited or congenital bleeding disorders, and we go from newly diagnosed infants all the way through old age. The most common of all of the known congenital bleeding disorders is von Willebrand's disease that usually affects 1 in 200 people. So pretty often you'll pretty sure know somebody that may have it. The other ones are a little bit more rare. Hemophilia A and hemophilia B particularly affect only males, and the incidence is a little bit lower, 1 in 5,000 males for hemophilia A and 1 in 30,000 males for hemophilia B. Then the other factor deficiencies usually are even a little bit more rare because they're inherited as what we call autosomal recessive. So you need 1 copy from mom and 1 copy from dad. And so these disorders are on the order of 1 in 500,000 or more. So 1 in a million for 1 in 500,000 for factor 7 deficiency, 1 in a million for factor 10 deficiency, or factor 13 deficiency. As you can see, we love Roman numerals. And then other disorders are platelet disorders that kind of can manifest as similarly with mucocutaneous bleeding. So the most common symptoms that we see with all of these are nosebleeds, gum bleeding, easy bruising, and depending on the severity, it can be associated with intracranial bleeds, joint bleeds, muscle bleeds, and usually the people that are more severe will present earlier in life, and people that are more on the mild spectrum will present later in life, depending on what bleeding challenges they may have.
Awesome. Thank you, Dr. Abajas. Okay. So this is a chart of our programs and services that we offer. I won't go through all of them because I want to make sure that we don't go over time. But for services, a big bulk of what we do is our medical IDs and seatbelt straps. And this is extremely important when our community members or if they have a medical emergency so that those first responders can be informed. And we also have some financial assistance programs and scholarships for those who qualify. And then we also have numerous programs where community members can be involved. For example, we have our advocacy program and we hold monthly meetings so that community members can stay informed about our current policies or how it is they can advocate for themselves or for others. We also have programs specific to men, women, teens, and parents. And of course, we have our Unión Latina, which is intended for Spanish-speaking community members to have that culturally supportive space for them and for their bleeding disorders. Yeah, and then I'll hand the invisible mic over to Dr. Abajas to talk about our initiatives.
So why are we specifically trying to target our Latin population? And it really is a twofold goal. One is to increase awareness, education, and turnout of Latino patients with bleeding disorders through culturally relevant engagement and support. And then the more objective measures to really try to identify strategies that increase the turnout and participation of patients, specifically in the Bleeding Disorder Foundation North Carolina Latino events. And so historically, we have encountered that it is a little bit harder to connect with the Latino population. And so we're BDFNC created a Latino committee with that two of our social workers from Wake Forest and UNC are part of, and I'm a part as well. In addition to Guillermo, one of our patient advocates, and Jasmine and Charlene, and just trying to find out what are new ways or different ways that we need to reconnect with our Latino patients, because the turnout is low and we're not quite sure how to improve that. So, and the main reason to focus on all populations are important to identify, but in particularly just focusing on Latino communities, is that there is a higher risk of underdiagnosis due to language access and cultural barriers, limited access to specialized care in underserved areas, especially if they're traveling from far, and then a general kind of sometimes mistrust or discomfort with the healthcare systems that may affect turnout and treatment adherence.
All right,
And
thank you.
we'll address that in just a second.
Sorry.
Escobar Garcia. The purpose of these events are mainly educational and community outreach. And so they would be learning about resources, different topics. So topics that we have done in the past or that the BDFNC has done are new treatments, complications of therapies, how to optimize 504 plans in school, mental health. So all related, different topics related to the bleeding disorders population. And they would be gaining specifically information regarding resources, knowledge, and empowerment and patient advocacy. And Jasmine, you can take it away.
Sorry. It's good. Sorry, guys. I have like dual monitors, and so bear with me for a second. Okay. Presentation still good, right?
Yes.
Awesome. Okay. And so with that being said, I did want to talk about our outreach strategies that we've been doing so far. And so we've had our bilingual and educational materials. And so, for example, here at our office, we have a whole bookcase dedicated to materials in Spanish. And that's whether, they're maybe like kids' book talking about hemophilia or just pamphlets for parents and adults and how it is they can better understand a bleeding disorder, whichever one that they might be dealing with. We also make sure to make an effort to have those flyers and postcards sent out to our Spanish speaking patients. We hold community dinners in Spanish, and these topics range from a variety of things. So, for example, we had one last month where we discussed how to prepare for an emergency room visit when traveling or just when you're not in your hometown. And then we also had one that was focused on back to school and how it is those parents can better support their children at school or how to advocate for them. But yeah, essentially, we partner up with these pharmaceutical industries and they have Spanish speaking presenters. So the whole presentation is done in Spanish, and it's just a great way for community members to get involved. And then partnering with Latino organizations is something that we're trying to incorporate a little bit more right now. We have our Spanish speaking patient advocates, which is usually either me or Guillermo, who is in the call right now. He does a lot for our community and has done it for many, many years. And we also have some social media campaign and culturally sensitive messaging that tries to reflect as much as possible those family and community values. Again, dual monitor. Okay. And so, for that being said, kind of how Dr. Abajas was mentioning before, we have these strategies in place, and we're still having a tough time with participation in our Union Latina program. And we know that that can be due to numerous reasons. And so we really wanted to get the opportunity to ask you all a couple of questions, to help us identify these unmet needs so we can try to pivot our strategies in a way that can better support our Latino community. And so I'm essentially going to go down the list. And if you guys could leave in the comments or in the chat any answers that you think might be helpful, and we'll make sure to jot them down. So I'll start off with the first question, which is what are the challenges that Latino patients have when accessing subspecialty care? And I'll give you guys a couple minutes to leave anything.
And Jasmine, maybe because of for purposes of time, maybe we can just like run through the questions and then people can just like comment. Or if there's something that like that you guys want to voice out loud, I don't know how the preferred method or platform for communicating, Hania, is. But just for purposes of time, I think we have like 2 more slides, but I want to be mindful of that.
But we have time, and we like opening for dialogue. I think.
Oh, perfect.
Si puede, voy a hablar esto en español, está en el canal que entienden, ¿verdad? Como doctora, como médica de familia, yo creo que todavía hay muchas personas de la comunidad que no están enteradas del todo acerca de estos problemas. Quizás no hay tanta concientización, en parte quizás porque no sé si los números de miembros de la comunidad latina son tan altos, pero a la vez creo que la falta de información es lo que hace que no se dialogue, ¿no? Entonces, ¿cuáles son los... mira, la pregunta primera, ¿cuáles son las barreras para que los pacientes latinos tengan para acceder a cuidado de subespecialidades? Con eso ya podemos estar 3 horas hablando, ¿verdad? Pero creo que es importante que el grupo de ustedes entienda un poquito cuáles son esas barreras y que si hay quienes quieren comentar un poco, sería un momento de poder hablar y luego hablar de eso y seguir con la pregunta que sigue y así. ¿Qué les parece?
Perfecto.
Ahí vi, Perla, habías contestado algunas cosas.
See, well, I'm going to say it in English, but, you know, a lot of times, like Dr. Viviana said, people don't know about where to even go to ask these questions, right? Who to approach about this question. Awareness is definitely a problem. And then accessibility. Who do you go to ask about these questions, right? Do you go to an organization? It's just like getting the word out more. There needs to be more awareness about it. Language barrier is something I get on my soapbox about, because if you have care for Latino communities, then you need to have staff that can relate, that can be culturally sensitive and understand that Spanish is a language, but there are so many countries that speak Spanish. And for example, I'm from Ecuador, and there are words in my country that mean something totally different in another Latin country. So making sure that we have that, access to bilingual interpreters would be amazing. And then the cost that's involved, right? How much will it cost to get specialty care? We know that that comes with a dollar sign. So knowing where to go to find out if there's any assistance or what the case may be. So those are just some of the things, but I saw Luisa put something in the chat too. And I'm sure she has her hands up.
And
And
before we go to Lisa, we had another private participant just share this feedback to that first answer. They said they need to engage trusted messengers. And then their feedback is that this format is too structured. I will confirm exactly what they mean by that, but maybe something that is more relatable in terms of like the bigger terminology and lingo that's used and jargon that's used in the medical field, like something that like we can go and talk to our abuelita about, right? Something that our tios and our tias can really understand is something um, that can just make it relatable to them. But I'll also confirm with the participant to make sure that that was the correct interpretation. But yes, Luisa, you had your hand raised.
Thank you. Yeah, agreed. I mentioned about like health insurance. Disculpen, voy a cambiar al español, pero creo que una de las cosas más importantes es lo de tener acceso a cómo pagar, porque muchas veces vienen fundaciones o clínicas a platicar y quieren acceso a la comunidad, pero están ofreciendo algo que la persona ni siquiera puede proceder. Yo creo que venir a la comunidad, hablar con las personas que tienen el conocimiento de la gente, pero antes de llegar ahí, tener la información de los diferentes escenarios que cada persona va a tener y cómo poderle servir o ser de uso a los diferentes a la diferente gente que lo pueda necesitar, porque si alguien no tiene acceso a seguro médico, si no tiene pues sí, un especialista para su enfermedad específica, eh, eh, sorry, blood disorder, es muy difícil que, pues la información obvio de cómo prepararse para una visita de sala de emergencia, excelente, es perfecto, eso es muy específico y algo que se puede utilizar. Los padres, cómo ayudar a los niños a prepararse para la escuela, cómo comunicarse con la enfermera, va a ser súper útil. Pero muchas veces si le estamos ofreciendo un tratamiento o algo que la persona no le tenga acceso, creo que sería súper importante que ya de antemano se creen esos vínculos para uno asegurar de que si tienes seguro, ok, listo, esta es la avenida que puedes tomar, pero si no, estas son las opciones que sí existen y que uno no esté pues, dando información que no se, en la cual no se pueda actuar.
These are all great comments. And I think as a subspecialist, yo puedo hacer también Spanglish. So no sé si la mayoría de las personas hablan español o inglés, but I'll do Spanglish. Yo creo que
Yasmina, if you just for the sake of the interpreter, if if
one
your
language.
line can be like one fully in English and then if you need to do the other one
Yeah.
in Spanish,
Perfect. Yes.
yeah.
I think one of the biggest challenges, or I think for as a subspecialist, it's I feel spoiled because I already know the patients that I need to know. But I think, and I don't want to speak for you, Jasmine and Guillermo, but for DDFNC is I think it's a twofold problem. The first one is like identifying patients that don't know that they have a bleeding disorders, but even it's just also just engaging our existing Latino patients in across the state that are already identified as having a bleeding disorder and see subspecialists is just how to make events or themes or presentations or whatever more targeted so that they are interested in attending. So yes, like I want to share all the information to everybody, but even I think the first step is just engaging our existing patients so that they are interested in attending. Like how do we like best communicate? Jasmine, do you think that's a fair statement?
Yes, yes, I do. Like you said, it's sometimes a little bit difficult because we're also handling things that are outside of our control, like insurance, and we understand that those are like very, very big factors in somebody receiving care. But yeah, kind of how Dr. Bajas was explaining, we're trying to, pay attention to both sides, and that's kind of where our where we run into some issues. And also, yes, it is a very specific population. We're talking about Spanish speakers with bleeding disorders, but we definitely do think that we can try to figure out other ways in which we can get more people involved, because it could be that somebody doesn't even have a bleeding disorder themselves, but they end up understanding the symptoms, and then that ends up being like their cousin, their aunt. So yeah, I know we have a couple of questions.